I'm Henry Andrew Hansen II. I'm opening a new office in Houston. I'm a native Texan. I grew up in Port Arthur, about 100 miles east of Houston. Went to Texas A&M University. From there, I went to Texas Tech School of Medicine. We were the first class. And then I had the distinct privilege of training under Dr. Michael E. DeBakey, renowned cardiovascular surgeon in Houston. Spent 4 years there, and then did thoracic and cardiovascular surgery at Emory in Atlanta. I went out into practice in 1981 in Lubbock, and where I spent most of my career, except for about 6 years. I came back to Houston and was on the faculty at Baylor College of Medicine, and I've been in private practice ever since. In biology class, I'll never forget Dr. DeBakey was doing some revolutionary things just 100 miles away from me in Houston. And I knew then I wanted to be a cardiovascular surgeon. And in that program, we trained to take care of all blood vessels, artery, veins combined. I've really enjoyed taking good care of people. And the thing I've liked about veins is I can help improve their quality of life. It's not life-threatening or as highly stressful as cardiac, thoracic, and vascular surgery, but it's a great time for me to do office-based vein care, which I've been doing since probably 2007, actually 2005, and I thoroughly enjoyed it. And the feedback from patients is exceptional, and it's a reason to get up every morning. I don't have any intention of retiring. I like taking care of patients too much. And I established relationships with patients that I was unable to do when I was, talking to them in ICU. I play golf with a lot of my patients. We go to dinner with some of them. We have fun. Our office culture breeds that same kind of feeling. Most of the patients know our staff very well, and our staff knows them. And one lady actually from Philadelphia said, "I know you so well, I feel like I should have you over for Sunday tea." So that to me is what makes it worth fun going to work, is to meet new people, get to know them, and help them with their medical issues. I followed Center for Vein Restoration, CVR, for a number of years, and have taken their Zoom meeting for continued medical education for quite a few years. And I was always impressed with the quality of the speakers. And this is a company I've been, almost joined a few years ago, and I wish I had. But they've got a great reputation, and they are definitely have a lot of integrity in the vein space. And they have not been able to, they just have the two offices in Houston. And I thought this would be a prime time to move to CVR in the Houston area and be their first Houston clinic, and hopefully bring my loyal physicians and patients back into that practice. I'm obsessive compulsive about patient care, and I've had that ever since I trained under Dr. DeBakey. And patients come first, and I loved helping patients relieve the issues that brought them in and improve their quality of life. I thoroughly enjoy the relationships I can develop with a lot of the patients, and I want to give them the best care possible. I stay at the cutting edge of this technology. In fact, I began getting involved with some of this technology in the early 2000s when it first became available to allow really complete vein care to be done in the office. I've always wanted to be a surgeon, a cardiovascular surgeon. I was fortunate to train under one of my childhood heroes, which was Dr. DeBakey. It's been a very rewarding field because the feedback from patients has been excellent. This time in my career, I don't want to retire, but I don't want to get up at 3 o'clock in the morning and go do an emergency heart. This is such straightforward, good results, safe, and I thoroughly enjoy it. I look forward to getting up and going to work every morning. like our referring doctors to know that we'll take good care of your patients, and we'll keep you informed. I know with the internet capabilities now, you'll get an emailed or faxed note right away, but I also like to do personal letters to my doctors, some of which, if I have their cell number, I'll screenshot and send to them that instant. I think that communication is critical in taking care of the best that you can of patients so that everybody's on board and on the same page.